ASALAAAM. Good afternoon to one and all. Today in this video, let's have a brief discussion about intestinal obstruction. So what is intestinal obstruction? Intestinal obstruction is a disorder of lower gastrointestinal system that is characterized by interruption or blockage of the passage, we can say passing of the stomach contents downwards to the lower gastrointestinal system. We can say small intestine and large intestine. Okay, what are the classifications of this intestinal obstruction? There are mainly two broad classifications. The first one is mechanical, or it's also known as dynamic. Second one is non-mechanical, or it is also known as adynamic. What is mechanical obstruction? What is mechanical intestinal obstruction? The mechanical intestinal obstruction can be defined as when there is the normal contraction of the muscles of the bowel or normal peristalsis, or there is the excessive contraction of the we can say lumen. We can excessive contraction of the muscles of the intestines, that is small intestine, large intestine, that may lead to the obstruction. And what are the causes? How this mechanical obstruction is caused? The first abundant cause is cancer. If there is the colorectal cancer, there is the colon cancer, small bowel cancer, or large bowel cancer, this may lead to the obstruction. Second one would be chronic constipation. If there is a chronic constipation, there may also lead to we can say severe dehydration. Understanding? When there is a enormous amount of the fluids are lost by the body. Understanding? So it may lead to the constipation. And we can also say when there is the intestinal hernia. And intestinal hernia का मतलब क्या होता है? When there is the abnormal protrusion of the, we can say upward protrusion of the organ या part of organ. Okay, this abdominal protrusion of the organ of the intestine, it may lead to the obstruction, understanding, to the flow of the obstruction to the flow of the stomach contents into the small bowel or large bowel, depending on the area or site where the hernia has been affected, where the hernia has been produced. Okay, so there also may be the cause like we can say worm infestations. Understanding? When there is the worm infestations, when there is the growing of much more worms, so it will also cause. And if there is a diverticular disease, a diverticulitis, this will also lead to the what we can say, this will also lead to the mechanical. This is known as mechanical obstruction. Now next one is a non-mechanical. See, in the mechanical, I have told you there will be the peristalsis and contraction, normal contraction, and there may also be the large, we can say, severe contractions. Okay. So, but in the non-mechanical, there is the absence of peristalsis. There is the absence of peristalsis. And that is the movement of the this one intestinal muscles. Okay. So when there is the absence, that is known as mainly aperistalsis. Okay. When there is the aperistalsis, we can say adynamic this one obstruction. Okay. So what will be the cause of? There will be the mainly three causes. Okay. The first one will be the neurological. Understanding? When there is any misconduction of the nerves, when there is any problem with the nerve conduction, any vagus nerve जो mainly serve करता है nerve supply to the this one intestines, या we can say gastrointestinal system, अगर वहाँ पे nerve supply में कुछ problem हुआ है या कुछ और blockage या कुछ problem हुआ है तो जिसकी वजह से हो सकता है misconduction. Okay, या when there is the abnormal nerve conduction. Okay, next one would be muscular. If there is any muscle disorders, okay, if there is any muscle disorder, muscle में कुछ problem हुआ है तो इसकी वजह से भी हो सकता है. And third one is the vascular. Like for example, if there is a mesenteric artery, in the there is the clot formation, or we can say there is also the when there is the atherosclerosis, any formation of the we can say deposition of fat inside the mesenteric artery, it may also lead to the intestinal obstruction. Okay, so this was all about the types. Now third one is, let's talk about the types. Okay, what are the some types of the what are some forms of the intestinal obstruction? The first one is simple obstruction. In the simple obstruction, when there is the obstruction is being caused to the only one area या one point, यानी जो intestine होगा सिर्फ एक ही area में, चाहे proximal area होगा या distal area होगा, तो सिर्फ एक ही area में obstruction हुआ है. That is known as simple. Next one is the closed loop obstruction. When both proximal end and distal end is obstructed, that is known as, that is mainly that is called as this one what we can call as closed loop obstruction. And third one is strangulated. Okay, yeah, strangulation. It can also be caused strangulated, and this one obstruction, it can be also caused due to the strangulated hernia. Understand? Strangulated hernia, which is caused due to the abnormal flow of the blood. Yeah, we can say when there is the blood clot. Yeah, when there is the problem with the blood vessels, when the mesenteric blood supply is unable to mesenteric artery is unable to this one unable to bring this blood supply to the intestine. It may also lead to the this may lead to the obstruction that is known as strangulated obstruction. Okay, so this was all about the types, and you can see some types of some forms of the intestinal obstruction. Now next one, let's talk about the symptoms. Okay, so what are the symptoms of this? The first and foremost symptom would be pain, understanding. Next one would be the regurgitation. Next one would be the we can say heartburn. Chest pain would be also there. Pulmonary aspiration because of regurgitation. There will be the edema. There would be the peritonitis, inflammation of the peritoneal membrane. Understanding, because of the excessive contraction of the muscles of the lower, small and large intestines. Okay, and there may also be the pain. Epigastric pain will be there. Understanding, indigestion will be there. Understanding, and constipation will be there, and melena, bleeding will be there. Okay, so and sometimes there it may also lead to the dyspnea. Why? Because there is the pulmonary aspiration. So these are all the symptoms, you can say clinical features of the intestinal obstruction. Now next one is about the diagnostic evaluation. How you will be diagnosing this intestinal obstruction. Okay, the first and foremost cause that would be the first and foremost diagnosis that would be history taking, history collection. If there is any past history of if there is any history of cancer, understanding, and you can also reveal if there is any family history of this hernia and all that thing. Okay, that may also cause, understand, also cause the intestinal obstruction. And you may also take the history from the patient, whether he is taking the fluid, he was taking the fluids, he is having the severe dehydration. Okay, and next one is the physical examination. Under the physical exam, you have to apply the 4 methods, that is inspection, palpation, percussion, and auscultation. Through these methods of examination, you can reveal the symptoms of this intestinal obstruction. Next one would be a CBC, that is complete blood count. Next one, you can go for the radiological examination like CT, MRI, abdominal X-ray. You can also go for the endoscope, some you can say endoscopic procedures, understanding in order to detect the abnormalities of the stomach or gastrointestinal system. You can also go for the PET, that is positive non-emission tomography. You can also go for the colonoscopy because there is the problem inside the colon. You can go for the sigmoidoscopy. You can go for the this one we can say colonoscopy, sigmoidoscopy, okay, gastroscopy. So these are the things you are going to do in order to rule out what are some problems. And you can also go for the serum electrolytes. We are also going to check the serum electrolytes, the presence of the electrolytes in the serum, blood serum. Okay, and you can also go for the blood test. So these are the diagnostic evaluation. So now let's talk about the management of intestinal obstruction. How you will treat intestinal obstruction as a nurse. First and foremost, you must know what is the type of intestinal obstruction and what is the cause and what is the condition. If the condition is, if there is no strangulation, if there is only the simple obstruction, understanding, so that time you can give the laxatives, you can give the purgatives, you can give the this one NG2 feeding, understanding, you can give the IV fluids, you can give the antibiotics in order to relieve the obstruction, understanding. Okay, and you can also give some drugs like gastrointestinal stimulants, understanding, in order to soften the stool. Okay, so you can use the stool softeners, some drugs which can release which can break the stool. Okay, yeah, which can make the stool to flow, yeah, to move forward into the intestines. Okay, now last one is about what would be the surgical management. See, in the cases of the severe obstruction, when the permanent obstruction is there, understanding, so after you have taken the medical management or pharmacological management, if this management does not work, if the symptoms are not relieving, then you can go for the surgical treatment. Understanding, usually the surgery is done like small bowel resection, large bowel resection, colectomy. Understanding, it depends on the where the this intestinal obstruction is there. So if the part of the intestine is damaged, so that part of the intestine would be removed. Understanding, if there is the severe effect, severe damage, अगर severe damage हुआ है तो आप लोग, so what a doctor is going to do, he is going to remove this thing only. Understand, he is going to remove the this one affected part or damaged part. Okay, and then after he is going to anastomize the healthy part with the other healthy part of the intestine in order to for the promotion for the normal peristalsis. Okay, so this was all about the intestinal obstruction. I hope you have understood about the intestinal obstruction. Okay, so till Allah Hafiz, Assalamu Alaikum.